In Kano State, a breakthrough is happening behind bars. Over 3,000 inmates have access to full health insurance thanks to the Kano State Contributory Healthcare Management Agency, Kachima.
We went for an advocacy visit to the Comptroller General of Kano State to advocate for him on how we can relieve some prisoners. When I saw the condition of the prisoners, some of them have chronic skin conditions. Some of them have wounds that have not received any medical attention. So I was like, sir, the situations I'm seeing with these prisoners is not a very good one. He said, yes, Dr. Rahila, this is the situation we have. You know, if we decide to take some of these prisoners to the hospitals, we spend the whole day roaming around the facility trying to ensure that we cater for them.
As of September 2025, Kano is a home to 4,676 out of the 79,470 inmates across Nigeria. Now, inmates across the 10 settler prisons in the state enjoy 100% health insurance.
A tsawon lokaci gaskiya sai muka tare a gidan nan aka dauko mu daga Kurmawa aka kawo mu Janguza mun dan fuskanci rashin lafiya irin ta sabunta. So bayan wannan cikin addu'a cikin ikon Allah kuma muka samu tallafi daga gwamnatin jihar Kano. To tun daga nan dai muka zuwa gaskiya da kai kamar so 10 haka zuwa karban magani.
So we engaged a consultant dermatologist and we went there and spent a whole day treating all of them. So then after then we came to the agency, did all the documentation, and that was how the enrollment commenced.
We used to have a lot of cases. We refer them to any government hospital. It has been a very Herculean task because there was no finances, there was no attention, and it was out of pocket for the Nigerian Correctional Service to pay and the inmates relative. But before now, and as Kashma came into play as this new government, because it started in this new reception, we started pursuing this goal before, in the last administration, before this new administration, but we couldn't scale through. But with the coming of this new government, in fact, effortlessly, they came to us and they make the Kashma program effective.
My work here is to make sure the inmates are healthy. Whenever they are sick, they are being brought here. We treat them. So we give them the nursing care. Before the assessment into the Kachima, we used to have our drug supply from National Headquarters Abuja. With the assistance of the Kachima now, they used to help us a lot in getting drugs. So with that of the headquarters and the one we have from the Kachima, it used to help us to go a long way in treating the inmates.
This effort to attain universal health coverage is among the first in Nigeria, as many inmates for years have continued to struggle with several issues, including lack of access to proper health care.
The beauty of this program is that we did it in such a way so that we can strengthen the facility within the correctional center. That is, all the monies that we will be giving out, we will be sending them directly into the facility, into the clinics in the correctional center. So now, the correctional centers, in addition to the resources they will be getting from the federal government, they have resources from the state. So we have strengthened the facility. When the treatment supersedes what entails inside the correctional center facility, the person that is sick will be taken to either Murtala Mohammed Specialist Hospital or Muhammad Abdullahi Wasi Specialist Hospital or Sasunusi Specialist Hospital or any of our major secondary facility. There, they will be catered for free of charge. The only criteria for you is just to be a citizen of Nigeria. It's just for you to be a resident of Kano State. It's just for you to be classified as a vulnerable person. That's all you need. And then the other things is history.
Kano is setting an example where even those behind bars deserve quality healthcare.